I've struggled with this my whole life. Just made me so insecure. And life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lipo Gyno. Sunday morning, Lipo Gyno and beyond. Today's case is this 46-year-old gentleman, weighs about 170, right? 175, who in 2016, not by me, had liposuction done with non-stealth incisions. Here's one. I think there's one over here somewhere. I can't see, but he wasn't happy with that. Then a year ago, I did Vaser Lipo, fat grafting, and Renuvion J plasma. And as you can see, great delts, make a muscle with your pecs, great volume there. But, he had a baby, and not him, his wife, obviously. But he looks great. He's got the hint of a six-pack. But he gained a little weight with his wife, and he wants better here. He says too much grasa right here, and I absolutely agree. Glands are gone, and stealth incisions, you can't even see anything. So we're going to do a touch-up of chest and full abdomen. Stealth incisions, the same incisions in the armpit here, belly button, and my incisions way down here to re-liposculpt him. That's basically it. No fat grafting. He says, I'm happy, thrilled with the volume I've got, no gland removal, and no Renuvion J plasma. Tough to do Renuvion J plasma on touch-ups because of the prior surgery. But we can do the liposculpting and the tightening with the Vaser and everything on that. So top to bottom, neck to nuts, as I say. We're going to turn him on the sides and get back here. His back is great. I also did his back years ago. That's great. But, he gained weight through not working out and not eating healthy because of, getting a new baby and stuff of that nature. But Lebo stands by his work, and he's back here now, and we're doing the touch-up under local anesthesia, of course. But, I always improve my technique, so I'm gonna really sculpt his six-packs even better than I did before with my newer technology and newer instruments and just, better aggressiveness with what I do. All said and done, let's go.
Alright, once again, I am Hans. I am Franz, and we are here to pop your...
Alright, so this is a redo. I upped the Vaser to 80%, a little on the stronger side. Still safe for fat grafting, but we're not doing fat grafting on this young man. Good. Here, lift up that armpit. Head to the right a little, left, a little bit. Very important now. This is the third surgery he's had. So he's resistant to this. Probably due to diet and exercise. But we're going to do it one more time. So we're going to beat him up to make sure he eats better. All right, so we're vasering it, getting around the side of the boob, getting that space between the pecs and the lats, going to the side, going to the back, going to the lower belly. We are going to make incisions in the lower. We did, we're going to 16 here. So redoing this, but I did a year ago, and I get better and better, even after a day. I try something, I say I like it, and we do it. Like in this guy, we're going to really sculpt his six-pack. Alright, so here I am on the secondary one. I could be more aggressive. No gland, so I want to maintain the volume of the chest. But since I did him a year ago, I've perfected some little things. And I'm going to obviously employ them. Now, all right, so here I am, secondary. So in secondaries, I can be very aggressive because the skin's already been undermined. So I can really go superficial. So I can really etch and get into this area, especially elbow straight. Good, there you go. Especially this section between the lats back here and the pecs. I want to really empty the space. And that's where he held on to fat. He had a surgery not by me, I don't know, 4 years ago. I'm sorry, more than that, 8 years ago. And I did mine a year ago, a little bit more. He didn't really diet or exercise, so I always tell people get in the best shape before the operation, he's in better shape after. So he's coming back to me and we're doing a touch-up, which I love doing. He really gets you into that really great groove. Very aggressive. Like here I'm going to the lats back here, getting the superficial of that top of the lats. Way around to the back. here. Don't have to worry about nerves or blood vessels here. I know the level of depth where I am. And I'm always guiding with my other hand to make sure I'm at the correct depth. And right here, going superficial and deep, I'm going to head this off when we do the from down to up in a knee. It's all about lights and shadows. So now I'm creating this line and the shadow over here and the lights where we're going to sculpt the face back. Here, extra long instruments, right there. I can get right on down to the groin and feel for that cannula and go deep and create that nice shadow in there. And this is curved, I can curve it up, goes curved, I can curve it up to get the superficial, then curve it down, knowing where I am to get the deep. And from there, go to the sides, down to the tips. So okay guys, this is one way I do the six-pack ab. So I got my curved cannula right here, 4 millimeter, and I'm at the edge of this middle, 2, 4, and 6. I really these days sculpt the six-pack to perfection, as you can see, more than I used to. So I just concentrate right at this edge of the second six-pack, underneath the nipple, concentrate right here, and in a minute I'll show you the edge of this beautiful six-pack here, right there, boom, and that's just really six-pack. Make a muscle, suck in your belly, there you go, that is beautiful. Now I can even come here, get the lower one, go here, get the midline, from here, I know where I am, get to this intersection between the second and the third, and even either way, the first and the second. Obviously through the midline, really work at this. I want this deep. I want to slip and slide here. So I can go way up, what I did already. Get that cleavage. Now right here, just work right here, slow. Slow. All right? Yeah. There we go. I know where I am. When you're doing it as long as me, you know exactly what to do. Even going down to the belly button. Very slow. I can even twist it right here. Go along the sides. Twist it here to the serratus. Right there. Twist it to the upper serratus into the armpit. Get all that fat out. Do the lower one. Get to the sides. It's beautiful. And I can do it from the other side. Also, I can do it from the top. Let's do the top over here. You all right? Over here, the side. Right, like that. Side. Just like that. Get right in there. Beautiful. Get into the belly button. And I can even Cobra Kai. Oh, it's Cobra Kai. Right there. And get that midline. Cobra Kai. Karate chop. Wax on, wax off. Look at that. This is perfection. Dr. Lebo, Lebo Gyno, Sunday Lebo Gyno, Sunday Fun Day with Lebo, of course. Today we did this young man, he's 46, local from New York, who 8 years ago from somebody else, he had liposuction through irregular incisions, just really nothing. A year ago, a little bit more than a year ago, I did his gyno surgery and beyond. Gland removal, liposuction, chest, abdomen, Renuvion J plasma to tighten everything up, and fat grafting into his pecs and to his delts. He was thrilled. He just had a baby. Not him, of course, his wife. And he gained weight through the pregnancy and really, wasn't really dieting and exercising. Gained some weight. He said, Lebo, please, can you touch me up? And we did. So, and with my newer technique of really high definition, aggressive six-pack abs, we got more fat out. We got, oh my goodness, I think, how much out? 5 liters, I think? We got 5 liters of fat out of them. We got 4 or 5 liters of fat out of them. Sculpted, again, everything to his back. Etched to find the pecs, the delts, the six-pack abdomen, which you can really see. Suck in your belly, 2, 4, and 6, the midline linea alba, the linea alba, the V to P, stealth incisions in the armpit by the nipple, inside the belly button, and in the groin where we have closed drains, and to perfection. Now make a muscle with your chest. that great volume there. Look at the delts, the anterior and the anterior, the middle, and the posterior. That looks great. Look at the lats now. We etched defined him. The space between the lats and the pecs, all to absolute perfection. Make a crunch, make a muscle, suck in your belly. This is done under local anesthesia to perfection. So if you have gynecomastia, you call me. Of course, you got to call me. Because if you don't, your results will not look like this. It'll look ordinary, but I give you extraordinary results. 631-424-0101 or email me at jonathanleibowitz@gmail.com. Let's go.